welcome back to Nurses.co.uk. Today's video I want to talk about things that your nurse wants you to know. So this might be your mentor or your assessor or someone like that, somebody that is kind of above you as a student nurse and someone who you look up to and you aspire to be like. So this person wants you also to know things. So you want them to know things so they can teach you, but you also want to know things so that they can assess you and so that they can work through things with you. So some things I would recommend you knowing so that they like you and they respect you and they know that you have a good breadth of knowledge. My first one would be to, in your placement area, to look at the different types of paperwork and to get familiar with this paperwork and make sure that you know how to fill it out, make sure you know what this paperwork is for, because there will be oftentimes, especially in first and second year, where your nurse is like, oh, can you fill out this fluid balance chart or this turns chart? And if you don't know how to fill that out, it just creates a bit of friction. So I'd recommend, obviously you're not going to know in your first or even second placement, but once you start a placement, maybe if it's in a new hospital, just getting out that paperwork and looking through it and make sure that you know what's involved in that paperwork, you know how to fill it out, you know where to put the date, where to put your signature, and also why it's used. So it's all very well knowing how to fill it out, but if you don't know the reasoning and rationale behind it, then that's not really very useful. So that's one thing I'd recommend, and I definitely struggle with this at the start because there's a huge amount of paperwork as nurses, and obviously as a student nurse as well, you want to help out with this paperwork. So I'd recommend getting used to that, and that will make you a lot more confident and also make the nurse that you're getting assessed by really like you. So my second one is to make sure when you're on the ward that you know the routine. And this might sound ridiculous, but know kind of what's expected of you next. So if you finish the medication round and you're kind of, this is more, I guess, aimed at people who are just started nursing, but even in third year, when you're starting a new placement, you don't know the routine of that placement. You don't know the routine of that ward or recovery or theatres. So kind of on your first and second day, almost look at the time and be like, okay, so it's 11:30 now. This is when we finish the drug round. This is when we start to give patients food or drinks or turn them or wash them, and kind of get used to the routine so that when you're done your, let's say, medication round in the morning, you can say, okay, what's next? I know, actually now we fill up all the jugs of water and we put them on the patient's tables, or we get the closeout ready for that day, and kind of note what to expect next, because if you know what to expect next, then you can get prepared and make sure that you're kind of one step ahead and not going to be left behind. So that's one thing your nurse would definitely want you to know. My third thing is definitely to medication, and this is something that I still find really difficult as a third year nursing student, but I think knowing your basic drugs, so if you're going to a hepatology or gastro ward, to know those drugs that they use there and why they use them, because if you're on the medication round, often as student nurses we can be a little bit slow, and that's fine. We all have to start somewhere and we all have to learn. I was really slow at the beginning, but knowing what the drugs are, because they always say, my lecturers always say, that you should never give something that you don't know the use or the name of, or what it's used for, or what it can't be used together. So if someone's on two medications and they interact wrongly with each other, you shouldn't be able to know that, because that's your role as a nurse, to know that, to know actually we're not giving this today because of this, or the high blood pressure or low blood pressure or blood sugars, or you know, you have to be aware of so much more than just, okay, it says to give this, I'm going to give this. Like for instance, paracetamol, even the most basic, like when was it last given, has it been enough hours since the last dose, is it safe to give it now, yes or no? Same with antibiotics. So all of this, you don't, because obviously everyone knows what paracetamol is used for, but you need to know more than just, oh, it's used for pain. You need to know what can it not be given with, how long since the last dose, when should the next one be, and all stuff like that. And if you even have the basic knowledge of that, the nurse that's assessing you or mentoring you will really appreciate that, because it will mean they will have to not kind of slow down so much and explain things, and we'll just be able to say, oh, she knows what she's doing, he knows what she's doing, he knows what he's doing, and they're fine. So that's definitely my third one. And finally, remember that your nurse doesn't expect you to know everything. And I know those 3 things that I've mentioned previously might seem like your nurse wants you to be on it, know everything, have all of the answers for absolutely everything, but you know what, nobody does, and that's the reality of it. So I think, especially as a student nurse, realise that, take advantage of your student status and say, actually, I'm a student, I don't know. And even when you're qualified, you won't know all the answers to everything. So I think really knowing that and kind of honing in on that and saying, actually, I'm going to put my hand up and I don't know, because it's completely okay to ask questions and it's really good to ask questions. I just think that those 3 things that I previously mentioned will really help you kind of have a step up above everyone else on placement and just be able to get on with placement and actually enjoy it and feel like you were able to do things alone. Because I feel like that was one thing I found difficult at the start, was I felt like I was kind of always following my mentor around and saying, oh, like, what can I do? Is this okay? Is this okay? So knowing your boundaries, knowing your limits, but also knowing that you're not going to know everything and it's completely okay to ask questions is definitely a good place to start. So thank you so much for watching this video. Please, if you like this video, please give it a thumbs up and subscribe to the Nurses.co.uk channel for more videos just like this one. Bye!